So one of the things that we need to talk about in neurons is something we call selective vulnerability. Yeah, that neurons are vulnerable to hypoxic ischemic injury than glial cells. So if there was hypoxia, that is decreased oxygen, or there is ischemia, where the blood is not reaching that part of the brain, usually the neurons will become more injured, will be the one that will be more injured than the glial cell. That is the connective tissue cells. So that's what we mean by selective vulnerability. So the neurons tend to be more vulnerable to hypoxic injury and even ischemic injury than glial cells. So in early stages, we have eosinophilic, and I think we all know about eosinophilia. We talked about staining last time, so go check about the eosinophilic. Those are the pink staining. Those will appear pink staining, the neurophilic neurons in early stages. Then later on, they are followed by phagocytosis of dead neurons. So these dead neurons, once they die because of hypoxia or ischemia, they are phagocytosed, or they are eaten up by the phagocytes. In this case, in the brain, we have the microglia cells. And then what happens again in this situation also, there's likelihood of there being astrocytic proliferation, because as we said, the glial cells are less vulnerable, and so they will proliferate, they will increase in number. And even as we said before, that neurons are permanent cells. That is, once they are injured, they do not multiply again. They die and they are replaced by fibrous tissue. So gliosis is common end result of damage to central nervous system. So in many cases where the brain, there is damage to the brain or the spinal cord, usually that part where the neurons have been destroyed and they've necrosed, they are replaced by gliosis. That is astrocytic proliferation. That is the astrocytes mostly are the ones that increase in number.